Hi everyone, I'm Dr. Christina Young, obstetrician gynecologist at Grace Sloan Memorial Hospital in Seattle, Washington. I work throughout the hospital doing labor and delivery, gynecology consultations, and various exams, but my specialty is in infertility. I work with various cases of infertility in a number of situations, and today I'm here to talk to you about a disease that I commonly am involved with, and that is endometriosis. Being an infertility specialist in a populous city, I have come across this particular disorder a number of times. Endometriosis affects more than 200,000 people per year in the United States, and I have seen it occur in about 6 to 10% of my cases per year. Common symptoms of endometriosis are pelvic pain that can range from mild to severe, cramping or stabbing pain that occurs on both sides of the pelvis, in the lower back and rectal area, and even down the legs, dysmenorrhea, dyspareunia, and dysuria. Infertility is also a common symptom of endometriosis. Other symptoms include diarrhea or constipation, nausea and vomiting, headaches, and heavy or irregular periods, which is known as menorrhagia. There is no cure for endometriosis, so treatment involves pain management and management of other symptoms. Supportive care involves monitoring for changes or improvement, and self-care, like using a heating pad, are the most simplistic of treatments. More effective forms involve medication care like hormone replacement therapy, laparoscopic surgery, electrosurgery, and various medical procedures that target endometrial cells that include cauterization, ablation, electrocoagulation, and endometrial ablation are also available. Determining the nature and duration of treatment is entirely on a case-by-case basis. More severe symptoms and symptoms that continue to flare up even after previous treatment has been administered can continue to prolong the duration of treatment. More severe symptoms might require a more tactical approach like surgery. To help better educate you, I want to discuss a particular case to help you understand what endometriosis might look like if it appeared in your healthcare setting. I had a 32-year-old white female who was referred to the gynecology clinic at Grace Sloan by her primary care provider after complaining of irregular periods and pain to the lower abdomen and lower back, radiating in both legs. She has pain starting a week before her period should start and notices heavy bleeding with clots. She states she has attempted getting pregnant for 2 years without success. She's allergic to erythromycin, and the physical exam that I performed on her revealed tenderness upon palpation to the left lower quadrant and right lower quadrant of the abdomen. The female exam showed no tears, swelling of vaginal canal, normal cervical mucus, cervix of normal length, and no obstruction to cervical opening, and no signs of infection internally or externally of the vagina and labia. She has nulliparous, and after talking to her mother about her symptoms, she discovers she actually has a family history of endometriosis. Pelvic pain and infertility are classic symptoms of endometriosis. A diagnostic laparoscopy was performed, and diagnosis of endometriosis was confirmed by a pathologist from an endometrial biopsy. It is recommended that the patient undergo a surgical procedure such as endometrial ablation to remove endometrial cells. If surgical intervention is not possible or desirable, hormone treatments are another option. Oral/intravaginal contraceptives, progestin/progesterone, GnRH, Danazol, or Mirena are some of those options that she could pursue. The patient is also advised to manage pain with non-steroidal anti-inflammatory drugs like Aleve or ibuprofen to help decrease inflammation. As an advocate for women's health, it is important to educate women about the signs and symptoms of endometriosis so that we can be swift to treat the symptoms and educate them on the best ways to manage pain. The major problem with endometriosis is that if it is left untreated, endometrial cells, can develop in other areas of the body and cause numerous other health issues. In addition, infertility isn't just a symptom for many patients. It can be devastating, and being aware of a patient's emotional health is just as important to their overall well-being. Because there is still not a cure, as health professionals, it is our job to manage patient symptoms to the best of our ability and provide information that aims to support overall health. Thank you.